Joshua had stated, this meeting is being recorded. My name is Dean Labute. I'm the chair of the CARP Windsor-Essex Chapter's Long-Term Care Transformation Committee. And on behalf of our chapter executive board in this committee, I want to thank you for agreeing to join with us today and to answer the questions we have prepared and provided to you. Sandy, would you please proceed?
Good afternoon, Joshua. I'm a member of the committee, and I'm going to just go through the questions with you one by one. If you have any trouble hearing me, please let me know. Okay, I have a dog that I'm babysitting, and if he gets out of control, I'm going to pass it to another committee member. Okay.
Okay.
All right. So the first question was, what is your party's plan to provide a seamless system of home care, long-term care, and palliative care for our increasing elderly population in Windsor and Essex County?
Well, the first thing we've done is we've admitted that the healthcare system in Ontario is severely broken. We currently have, if you just look at Windsor, our hospital CEO makes more than the Premier of Ontario and the Mayor of Windsor. And there are lots of funds that are going around to people in charge instead of the programs that they're supposed to be delivering. And we would like to see that actually changed. We'd like to see a cap on increases in CEO raises. I know they often go up when you're talking $300,000. That is a significant increase. We'd like to take that and put that funding into programs that we already see that exist. I know in Windsor, we've started a lot of heal at home programs where my grandma, for example, had hip surgery and had a hip replaced and a knee replaced, and she does her physiotherapy at home. And I think we've seen a lot over the last 2 years where these programs where we've had in the hospital or in the clinics that were difficult to get people to can actually be delivered at home. And we'd like to see a lot of these funds go towards that, because when you're in the hospital, you get your therapy for the first couple of days, and then you're sent, if you're lucky, you get to go to more long-term, like the TAFOR campus here in Windsor, for example, for more healing, but that isn't always a choice for some people when they have to go home. So we'd like to see an increase in programs like that where they can go home and have either through Zoom or in person a therapist come, a support worker come to help to do it. Let's see, what else? I guess the other big problem we have here in Windsor is the lack of long-term care beds. Mm-hmm. And that's providing a very difficult transition. You can't be seamless when you have people stuck in one place and they can't move to some place where they can actually heal, get better. We do plan on addressing that, especially with the build of the new hospital. The new Blue Party is not interested in building a hospital that just covers the beds and services we have now. Our goal is to see at minimum a level 3 hospital here in Windsor that has 24 hours a day diagnostic imaging running, that also has at least at minimum a general surgeon on staff 24 hours a day so that operating rooms can work through the night. The closest hospitals that are level 3 to us right now are London and Detroit. Mm-hmm. And that provides a lot of stress on a family that has a senior when they have to send somebody to London or to Detroit. Then you have to take off time for work and go stay, and it doesn't work for us as a party because it doesn't work for the people of Windsor. So that's one of our big things to see. And then we have to also address the ALC patients that are taking up hospital beds now. They're taking up the beds because we don't have enough in the community. However, we can increase programs while we build places in the community for them. We can continue to expand the heal at home. We can even, I know sometimes it's been said, take whatever you can get and live with it. I don't think that's acceptable. However, to offer an opportunity, if there are beds available, to take those beds and then move to a home where you are more comfortable, where you had other experiences with people, go do things in places like that. And definitely an increase to the hospice's palliative care at home. I have been a volunteer with hospice before in their pastoral care department, and I have seen the success of at-home care that the programs provide. Doctors, the few doctors that they do have, provide house calls if the patients need it, which is very important to get the doctors there, the nurses there, the physiotherapists to the people in the community, and to let people know that these options are available. I don't know how many people know that you can receive palliative care, including palliative care medications that people think are hospital only, while you're at home. You don't have to die in a hospital. You can die at home with your loved ones around you, like I did with my aunt just 3 years ago. And she didn't have to die in the hospital, and I was there at her side. And it was fantastic. But the difficulty for that was we had to get the referrals through the CCAC and the home visiting nurses, which took about 4 or 5 days. And that means we only got her bed in the house before she passed away. So we need to consolidate this and have a program where if you're leaving the hospital and going home, or you're calling to have this intake, that we have enough staff. And I know that's another question coming up about staffing, so I won't get too much into it, but that they have enough staff to deliver these programs right away and not have people needlessly suffering at home.
Thank you, Joshua. And you've done a good job of touching on a number of our questions coming up, but I'll go through them one by one just in case you want to add. The next question is specifically about what your party would do to help more seniors stay in their own homes. And you started to talk about that. So would you like to add a bit more information to that one?
Yes, I'd like to see the eligibility for the programs expand to the seniors at home. Most programs now are, you have to be so far or of such an age or something needs to be there, but I'd like to see a way that we can introduce these programs to our seniors before they're at that point of needing them. And the party is committed to finding a way to do this, whether it be through programs with the hospice, with CARP yourselves. I've seen you around and know what you do. So our main thing is to let people know that these programs exist while also making sure that they're funded so that people can access them in a timely manner.
Great, thank you. Question number 3 is, what is your vision for long-term care? And specifically, we would like you to comment on how your plan will provide a quality and stimulating environment that is based on individual needs of seniors.
Absolutely. We think that long-term care should meet all the needs of its clients and the seniors there. And that's not just their physical health, but their mental health and also their social well-being. My friend's mom, before she passed away, she was a resident at Aspen Lake for, I think, 3 years. And the programs that I saw out of there, they had trick-or-treating at Halloween, Mother's Day, Father's Day parties for the children to come in and to experience that. And I just think it's fantastic. It's about 1.5 years since she passed away, but we're still talking about what she was able to experience there besides just her healthcare needs being met. The friendships she developed, the cards night. And we believe that these should not just be available at the better for-profit homes where people pay a fortune to be there, but programs like this need to be available in all of our long-term care facilities, whether it be through volunteer programs or actually paid employees of the home. I know the hospice has volunteers and paid employees that all they do the hair, they do the makeup, there's different clubs, some do the cooking. To see things like that in all of our long-term care, where not just employees, but even families can get involved. I've done the cooking at the hospice, and I would love to do that where family is, or serve the meals or something like that, because not only does it meet their needs of eating, socializing, but it also meets the family meets a need where the family is part of their care as well. And if there is no family, the fact that these things are being taken care of definitely helps alleviate the loneliness that can be experienced. Um, and we think that long-term care should be affordable for everybody. And that doesn't mean going to a place that looks like it's in the dumps. I know we've had some places that have had problems in the past. We think that properly inspecting our long-term care homes will go a long way to ensuring that our seniors are taken care of. No more seniors falling through the cracks, making sure there are enough workers, not just one nurse and one support worker for an entire ward or wing of a nursing home or long-term care home, but that there are at least registered nurses on staff at all times and enough helpers to be determined. We haven't come up with a number because we don't know. We don't know what you think is the right number. We don't know that, but we are more than happy to work with groups like you to come up with a number for safe staffing, client to nurse staff ratio.
Thank you. The fourth question, Josh, was what is your party's plan to attract and retain healthcare workers in home care and long-term care? And you've spoke already about what staffing client ratios does your plan include? And you talked about consulting to come up with that number. But if you could just talk about the retention and attracting healthcare workers.
Yes, absolutely. We know there's a problem here in Windsor-Essex because we train some of the most brilliant doctors and nurses and support workers and paramedics there are, and we lose many of them to Michigan. The problem we see is that here, what is offered is short-term contracts that may have full-time hours and definitely don't have benefits. My sister's a licensed practical nurse, and she just got a permanent part-time position 2.5 years after graduating from the program. And that's not acceptable. So many of her classmates went to the States. What we need to do is find a solution to these part-time, low contracts with no benefits is one of the first things. The second thing is to reevaluate the 1% pay cap on raises to nurses and healthcare workers. 1% absolutely is not acceptable for them. However, 50% a year wouldn't be a taxpayer either. So we need to find a number in there that balances the absolute worth of our healthcare professionals and the pocketbooks of people in Ontario, especially those on fixed incomes. We can't continue to raise taxes, and not provide a service that does something for them. We can raise taxes all we want, but if we lose all of our nurses, what was the point? And the other thing is, many places are allowing COVID positive healthcare workers to work. So why can't we rehire the ones that are COVID negative and allow them to work while they're negative?
Great, thank you. The last question is about accountability. As an electorate, how do we know you will put your plan into practice, the things you talked to us about? And what are your specific timelines and benchmarks for the implementation of the changes you've talked about today?
So to date, the New Blue Party has actually kept every promise it's made. There haven't been many, I'll admit that right now. But we promised to stand up for the citizens of Ontario in the legislature, and Belinda has done that on several occasions, including doing work on bringing attention to Bill 67, which was to put critical race theory into the actual curriculum, which included fines for subconscious biases. So she stood up against that. She stood up against the Reopening Ontario Act because we believe that everything that happens to people in Ontario should happen by debate in Parliament. you don't elect us so that 5 people get to go sit off at a table and decide what happens for Ontario or make a decision in 30 seconds. And we also promised to put a candidate in every riding in the province, and we've successfully done that. We were the first party to do that in this election. And so we've shown, and we promise to continue to show as we go forward. Our first main priority will be with bringing back the healthcare workers that can work that are COVID negative immediately. So that will relieve some of the burden there. And as you know, the current date on shovel in the ground on the new hospital is 2027, which is after the next election. But we would like to see everything finalized so that it can move forward, and at least the plan for the long-term care beds to replace what we're losing in the ALC beds, and an expansion of a place for ALC beds within the first term.
Thank you, Joshua. We have about 10 minutes left. If you're comfortable, our chair might have a question or two for you. Would you be comfortable if I pass things on to Dean to ask you a couple additional questions? Okay, Dean, I'll mute myself and I'll pass it on to you.
Thank you, Sandy. Joshua, the Ontario government during the crisis of COVID-19 in long-term care settings brought into law Bill 2118, which was the Support Ontario Recovery and Municipal Elections Act. It provided a shield to the owners and investors of long-term care and retirement homes in Ontario. If your party formed government, would it rescind this legislation?
Absolutely. If you run a long-term care home, you're responsible for what happens there. The buck stops with you. We can't keep shielding people from harms they do. It's happened so much during the last 2 years. It can't continue to happen.
Thank you. I have a second supplementary question for you. In Ontario today, approximately 700,000 Ontarians are receiving home care. At the same time, approximately 70,000 Ontarians are in long-term care. Unfortunately, when it comes to budgeting, 13% of the budget goes to home care, and 87% of the budgeted funds go to long-term care. If your party formed government, would it reverse this inequity in funding?
We would absolutely look at doing that. As I said earlier, we need to make sure that these programs are in place and everybody can access them. If we're spending so much money on long-term care and it's not being used as effectively as it can be used in home care, then absolutely we will put that money to where it's going to be used and where people can actually access these programs. Why have programs that people can't use? It sounds
Okay, well, thank you. Henry? Henry?
Good.
Is Henry there?
He's here, but he's muted.
Sorry, I muted because I have a clock in the kitchen that was beginning to strike. Sorry about that, Josh.
Not
That's
a
okay.
problem. Henry, would you please thank Josh?
By all means, on behalf of the group assembled, Anne and Sandy and Pat and Donna, Josh, thank you for answering our questions that the committee prepared for you. And we wish you well in the upcoming election. Thank you.
Dean, will you welcome Manpreet is on?
Yep. Manpreet, my name is Dean Labute. I'm the chair of our Windsor-Essex chapter long-term care transformation committee. On behalf of our committee and our executive board and our more than 2,200 members, we want to thank you for agreeing to meet with us today And as we have shared with you the questions, and I hope you've considered them, and we're going to ask for your answers to those questions. And at this time, I'll call upon Sandy to present the questions to you. Sandy?
Good afternoon, Manpreet. I'm just going to go
Afternoon.
through the questions one by one, and I will try to, like, if I find you've answered some of the other questions as we go, I'll certainly give you the opportunity to add, or if you want to pass, if you feel you've answered it already, okay?
Okay, sure.
So the
So
first
First of all, I just wanted to thank all of you, including me to this meeting. So I have got an opportunity to speak with all you beautiful people who's been doing amazing job.
Okay, thank you for that, and we look forward to our conversation with you.
Likewise, thank you.
What is your party's plan to provide a seamless system of home care, long-term care, and palliative care for our increasing elderly population in Windsor and Essex County?
Okay, so as we know, our seniors built the province Ontario, and we owe them a big our gratitude. And to make this province the best possible place to age with dignity, the future should bright for them. The Ontario needs a revolution in the way that we care for our parents and our grandparents. Ontario Liberals are proposing a transformation that will guarantee that any senior who needs care with their own homes will get it. We will end for-profit long-term care places by 2028. For those who may need more support, we will be funding 15,000 new assisted living homes, including small, accessible, and community-based residential services, as well as hub and spoke care, and provides the comprehensive continuum of care. We will help 400,000 seniors get home care with the $2 billion annually by 2026.
Thank you. Then the next question follows and it's specifically about what your party would do to keep more seniors in their own homes.
Okay, in retirement, as we all know, they want to stay home with their family, with their children, grandchildren, with their neighbors. And then the only Ontario Liberal Party understands that. And we will guarantee that whatever healthcare professional they need, they'll get that service at home. And we will also increase financial support for the caregivers. And we will give them more money to pay, things like, the grab bars, just to make more things accessible at home and more safer. In the addition to that, we'll know the high cost for the living makes it very hard for our seniors. For that, we will be increasing our old age security topping up by $1,000 per year. In total, like again, 400,000 seniors we have province-wide. So we will be have about $2 billion annually invested by 2026 to support them.
Thank you for those specifics, Manpreet. Number 3 is your vision for long-term care. And specifically, we're interested in you commenting on how your party is going to provide a quality and stimulating environment that will be based on seniors' individual needs.
Okay, so the Ontario Liberal Party recognized that our most vulnerable seniors deserve to live in an area of dignity and respect. Over the last 2 years, we have seen elders suffer in horrifying conditions to the point that we had to call military and to get that support. That is really heartbreaking memory. That we shouldn't forget that how our seniors were treated in past couple of years, because we don't believe in warehousing our seniors. They deserve much better than how they were been treated in past 2 years. We will end for the profit long-term care with the target of 2028, and then place audits, inspections, and zero tolerance sanctions on long-term care homes that endanger their residents. We will build and redevelop 58,000 new nonprofit long-term care spaces and ensure that senior in long-term care home service, they receive at least 4 hours direct care every day, as well as provide pharmacy service, high-speed Wi-Fi, air conditioning, and other standards of excellent care. The Ontario Liberal Plan would ensure that seniors feel at home while they receive care at any facility.
Thank you. The next question is around the staff that are in our, that are working with our seniors. What is your party's plan to attract and retain healthcare workers in home care and long-term care? And what staffing client ratios does your plan include?
So we are going with the delivering all the care with our seniors need means ensuring that we have and keep the people we need to do it. Before the pandemic, 6% of the nurses used to leave the profession every year. But during the pandemic, our learning is roughly, the number has been doubled. So roughly 15% nurses has left the profession. Working with their strong team of liberals, we will repeal the Bill 124. That will be a big help for our home nursing the people who are in that field, and raise the personal support worker base pay at least minimum $25 an hour. We will also provide additional wages for every person on short staff and shift, as well as deliver fair and consistent pay for work across home and community care, long-term care, and hospitals, a fair wage differential between PSWs, registered practical nurses, and registered nurses. We would recruit roughly more about 100,000 new healthcare workers. That is a big demand in this field at this point.
The last question that we sent you deals with how we as the electorate would be able to basically have benchmarks or have a way of making the Liberals accountable for all of the plans that you've laid out today. They're quite extensive. They could make a huge difference for home care and long-term care. And what specific timelines and benchmarks are you looking at for implementing these changes so that we can sort of watch what the Liberals are doing and make sure you're accountable for what you've promised?
Sure. I care deeply about the care our seniors are receiving, while these conservatives continue to send billions to for-profit providers just for the benefit of making their rich friend more richer, which is not fair with our seniors community here. And Ontario Liberal will treat seniors with the dignity and the care they deserve. We will end for-profit long-term care by 2028, and then 400,000 more seniors will get home care by $2 billion annual investment by 2026. And we will be redeveloping 58,000 new long-term spaces by 2028.
Manpreet, thank you for, you can tell that you put a lot of thought into these answers, a lot of detail. And because you did, the time went fairly, we've got quite a bit of time left. And so I want to know if you're comfortable, if I turn things over to Dean, our chair.
That's fine.
He has a couple of additional questions. So if you're comfortable, I'll turn things back to Dean. Thank you very much.
Sure.
Manpreet, thank you very much for answering those questions.
Mm-hmm.
I have two supplementary questions for your consideration.
Sure.
During the peak of COVID, while the deaths were rising in long-term care,
mm-hmm.
the Ford government brought in and made into law Bill 218, which was the Support Ontario and Elections Act. Now, the purpose of this act was to shield the owners of long-term care homes and retirement homes and their investors from legal action. Would a Liberal government in Ontario move to immediately rescind that law?
Yes, we will be working with all these organizations to support them, whatever is in a benefit for our seniors and then these long-term care folks. We are in a support of that.
Okay, thank you. The second question deals with money, which is something you talked about
mm-hmm.
in your comments. Presently in Ontario today, approximately 700,000 Ontarians receive home care.
Mm-hmm.
At the same time, approximately 70,000 Ontarians are in long-term care.
Mm-hmm.
The money budgeted
mm-hmm.
for these expenses is at the ratio of 87% for long-term care, 13% for home care. Would a Liberal government reverse the inequity in this funding?
So as I have mentioned earlier, we would be promoting that people age at home, and then they would be getting 100% funding towards to that, because it is as equal as if they go to a long-term care. But if they wishes to stay home and then age at home, they should be getting equal benefits. There shouldn't be anything like, one gets a 20%, another gets 80%. It should have been equally distributed.
So you're saying that a Liberal government would in fact rearrange the funding mechanism so that home care would have the proper funding to
Yes.
meet the needs.
Yes, we should have been working very closely just so that the home care should have a proper funding. So there shouldn't be anything shortage of the budgeting or anything.
Okay. Do you have anything else you would like to add before we let you leave?
Yeah, no, I just wanted to thank all of you lovely people, but I just wanted to share a story with you that touched me very closely, because I am living with my parents. I have two sets of parents living with me, my parents and my husband's parents. Both are in their mid 80s, and then one set is in their early 90s. And I can clearly feel that they would never wish to move to a place where they would have to leave their children and loved ones and getting treated like, what the stories I've been hearing, all that. And I can completely understand need for that, because when we put our platform together, I sat on that board to put all these pieces put together, because I know there was a lot of sentiments when I went out and I talked to seniors. I went and I talked to a lot of organizations. How should we handling this? So I know our Ontario Liberal Party's plan is going to be the best plan for our seniors, because we just want them to age with respect and dignity, because they have done so much for us. I am going to say that if I am here, it's because our seniors, they have put all the efforts together for us, and then made the province Essex better for a livable, so that we are enjoying today. So now this is their time to enjoy. They should be having all the benefits, and then there needs to be completed whatever they are qualified for.
Thank you. Henry?
Manpreet, on behalf of Anne, Sandy, Pat, Donna, and Dean, thank you for giving us your responses this afternoon and for sharing with us. As Sandy mentioned, obviously you've done some good work behind this, and we wish you well in the upcoming election. Thank you.
Thank you. I really look forward in the future working with all of you together for the betterment of our Essex area.
Thank you, Manpreet.
Thank you.
Thank you.
Goodbye.
Bye-bye.